So, what is mental health? The World Health Organization defines mental health as a state of well being in which an individual realizes their own abilities, can cope with the normal stressors of life, can work productively, and is able to make a contribution to their community. It is more than the absence of mental disorders. Mental health is reflected in how we think, feel, and act. Good or positive mental health looks like a positive approach to life, feeling of balance, satisfaction, and effectiveness, and stressful events are experienced as challenges and not difficulties. However, a declining or poor mental health would look like changes in ability to cope with stressors, changes in mood, attitude, or physical health, and not necessarily a diagnosable mental illness. A person can, however, often function normally and may appear healthy to others. It's important to note someone's declining mental health and take steps to restore good mental health. And if someone is experiencing a decline in their mental health, it is not necessarily a mental illness. So now that we know what mental health is, what are mental illnesses? And how would you describe mental illness, and how is it different, or is it even different than mental health? We often see or hear the terms mental health and mental illness in everyday conversation, but what is the difference between them? Mental illness is characterized by changes in thinking, mood, or behavior, or a combination of the three, associated with substantial distress and general dysfunction. Everyone feels worried, anxious, sad, or stressed sometimes, but with a mental illness, these feelings are frequent or constant and interfere with daily life. Mental illnesses can make it harder to meet and keep friends, find and hold a job, or enjoy life. Mental illnesses aren't something we can diagnose in ourselves or others. They are formally diagnosed by mental health professionals. People who have diagnosable mental illnesses can live satisfying, fulfilling lives if they have right tools to support their wellness. A really good way of thinking about mental health is using this continuum. This is called the mental health dual continuum. A mental health dual continuum considers biological and psychosocial factors of mental health and well-being. It emphasizes that mental health and mental illness can coexist, such that individuals experiencing mental illness can thrive in our societies and post-secondary communities. The horizontal axis represents the presence of mental illness symptoms. The more right, the more symptoms a person is experiencing, and the more left, the person experiences less or no symptoms. The vertical axis represents how the person is doing with their mental health. The lower on this axis, the person experiences poor mental health and well-being, and the higher on this axis, the person experiences positive or optimal mental health. Let's take a look at each of these quadrants. The top left, a person is experiencing a high level of mental health and well-being and has been diagnosed with a mental illness or has mental illness symptoms. We see that these people are practicing strategies to support their wellness and maintain their mental health. People who practice positive coping and take steps to address their mental health can see a reduction in mental illness symptoms and move more towards the right of the continuum. Top right, a person experiencing a high level of mental health and well-being with minimal or no mental illness symptoms. In this quad, we see people also practicing strategies to support their mental health and well-being. It's important to note that sometimes, regardless of your lifestyle choices, some people may develop mental illnesses. Many factors have an influence on whether people develop an illness, like genetics, environments, events, and stressors, but practicing positive mental health coping will support overall well-being regardless. Bottom right, a person experiencing a low level of mental health and well-being with minimal or no mental illness symptoms. These people may be struggling with motivation, maybe neglecting self-care, and the stress may be adding up. If people continue to stay in this quad, they may start to develop mental illness symptoms. And lastly, the bottom left. A person experiencing a low level of mental health and well-being and has been diagnosed with a mental illness or has mental illness symptoms. These people are experiencing mental illness and are struggling with taking actions to support their well-being. There are various tools, resources, and apps that you can use to help understand your mental health signs and symptoms. Here at MacEwan, we like to review the Mental Health Commission of Canada's Mental Health Continuum tool. The Mental Health Continuum tool recognizes the spectrum of all mental and physical health problems that may affect people during their lives. The continuum goes from healthy adaptive coping, which is the color green, through mild and self-limiting distress or functional impairment, which is yellow, to more severe, persistent injury or impairment, which is orange, and clinical illnesses and disorders that need more intensive medical care, which are red. The arrow under the 4 color blocks highlights that mental health is a continuum, one you can move back and forth on. Many people have physical and mental health problems that, when identified and treated early, can be temporary and reversible. Even if injured or ill, it's possible to return to health and function at a high level. Using the colors to talk about mental health helps prevent people from using stigmatizing labels. It also helps diagnosing others, which should be left to healthcare professionals. The Mental Health Continuum tool is a self-awareness tool that can help you understand changes to your mood, attitudes, behaviors, or physical changes, or in your use of substances and addictive behaviors. Everyone is different when it comes to experiencing poor mental health, and it is important to be aware of your own baseline and when you move from that baseline. One person might primarily struggle with physical and social functioning, whereas someone else might primarily experience thinking and emotional difficulties. This tool allows you to reflect on your signs and indicators of good, declining, and poor mental health and well-being. Think about your coping and your signs and indicators within each of these areas, and use this tool to check in with yourself periodically to see how you're doing. Check in reflecting on the changes to your mood, attitudes, behaviors, or physical changes, or in your use of substances and addictive behaviors. To learn way more about this continuum tool, look for the Inquiring Mind workshop hosted by the Wellness and Psychological Services. It's a 4-hour workshop all about mental health, coping, and creating a supportive campus environment for all.